Reports surfacing from the southern reaches of South America have sparked international alarm following a significant surge in hantavirus infections across the Patagonia region, leading to sensationalized claims of the area being rendered a forbidden zone. In the second week of May 2026, public health authorities and international monitoring agencies have moved to address these reports with a mix of high-level surveillance and logistical intervention. The epicenter of the current concern is the Argentine province of Tierra del Fuego and the broader Patagonian wilderness, where the Argentine Health Ministry has documented a sharp increase in cases. Since June 2025, officials have recorded 101 hantavirus infections, a figure that nearly doubles the caseload from the same period the previous year. What has elevated this situation from a regional spike to a global health priority is the specific involvement of the Andes virus strain. Unlike most hantaviruses found globally, the Andes variant is uniquely capable of limited person-to-person transmission, a factor that has historical precedent in the region but has rarely been tested on an international scale until now. This biological characteristic has turned a localized rodent-borne threat into a complex tracking challenge for epidemiologists, as a single infection can theoretically trigger a cluster within close contact environments like households or, as seen recently within the confined quarters of international travel vessels. +2, the geography of this outbreak is as challenging as the pathogen itself. Patagonia, a vast area spanning southern Argentina and Chile, is the natural reservoir for the long-tailed pygmy rice rat, the primary carrier of the Andes virus. While the virus is endemic to these forested hillsides and rural communities, the scale of the 2026 surge has prompted extraordinary measures. The World Health Organization and the Pan-American Health Organization have been coordinating with local ministries to determine the drivers of this escalation. Preliminary assessments point to a combination of environmental factors and shifting ecological boundaries. In many endemic regions, the flowering and seeding of specific bamboo species, such as the colehu bamboo, provide an abundance of food for rodent populations, leading to a mouse rush or a population explosion. When these rodents proliferate, their proximity to human dwellings and tourist hubs increases, raising the risk of viral spillover. The current reports of an aggressive surge come amid a broader epidemiological alert issued by PAHO in late 2025, which warned of increased hantavirus activity across the southern cone, including Bolivia, Brazil, and Uruguay. However, the intensity of the Patagonian cluster has captured the world's attention, particularly as the virus's high fatality rate, recently measured at over 30% in some cohorts, collides with the region's status as a premier destination for international ecotourism and expedition cruising. The core of the current international developments centers on a specific cluster linked to the expedition cruise ship MV Hondius, which has become a focal point for global health agencies. The vessel departed from Ushuaia, Argentina, often called the end of the world, on April 1, 2026, for a transatlantic voyage. According to reports from the World Health Organization and the European Center for Disease Prevention and Control, a cluster of severe respiratory illness emerged among the 147 passengers and crew while the ship was in the South Atlantic. The index case, an adult male, began showing symptoms of fever and gastrointestinal distress on April 6, only days after departure. His condition deteriorated rapidly into respiratory failure, and he died on board on April 11th. The subsequent death of his wife after she disembarked in South Africa, followed by additional infections among the crew and medical staff, confirmed that health officials were dealing with a high-consequence pathogen. Laboratory testing conducted at the National Institute for Communicable Diseases in South Africa and at specialized facilities in Germany and Switzerland used reverse transcription, polymerase chain reaction, or RT-PCR, to identify the presence of the Andes virus. Genetic sequencing has since confirmed that the cases share a nearly identical viral signature, suggesting they originated from a single zoonotic spillover event, followed by subsequent human-to-human transmission during the voyage. +4 Scherf, the response from official agencies has been swift but calculated. In Argentina, the Health Ministry has been retracing the footsteps of the infected passengers, focusing on their activities in the forested hillsides of Patagonia prior to boarding. While some local reports suggested Tierra del Fuego was the source, officials have noted that the province has not seen a confirmed case in 3 decades, leading investigators to look toward other Patagonian hubs like Bariloche, which recorded its first human case of 2026 in early May. Meanwhile, the logistical complexity of the MV Hantavirus situation has required a multinational effort. Passengers have been monitored across several jurisdictions, including St. Helena, Cape Verde, and South Africa. In the United States, the Department of Health and Human Services has supported the repatriation of American citizens from the vessel, directing them to specialized care at regional emerging special pathogen treatment centers, such as the University of Nebraska Medical Center. These facilities utilize high-level biocontainment units and negative pressure isolation rooms to manage potential cases. Despite the forbidden zone rhetoric seen in some media outlets, the WHO has categorically ruled out a general epidemic, emphasizing that the risk to the general public remains low because the virus requires close, prolonged contact to spread between humans. However, for those within the clinical and laboratory sectors, the 2026 surge represents a significant challenge in diagnostic speed and the management of hantavirus pulmonary syndrome, which typically progresses from flu-like symptoms to life-threatening pneumonia and shock within a matter of days. Prevention and surveillance remain the primary tools in managing the hantavirus threat as authorities work to contain the 2026 surge. Public health guidance issued by PAHO and the CDC emphasizes that human infection primarily occurs through the inhalation of aerosolized virus particles from the urine, droppings, or saliva of infected rodents. This is a critical concept for both residents of Patagonia and travelers. Simple activities like sweeping a dusty, long-closed cabin or hiking through dense brush can disturb dried rodent excreta, sending the virus into the air where it can be inhaled. To mitigate this risk, official guidance recommends that all enclosed spaces in endemic areas be thoroughly aired out for at least 30 minutes before entry, and that cleaning be performed using a 10% bleach solution or other heavy-duty disinfectants. The use of personal protective equipment, including N95 masks and gloves, is strongly advised for anyone handling potential rodent infestations. For the broader public, the advice is to store food in rodent-proof containers and seal any openings in dwellings that are larger than a quarter inch, as the primary reservoir species can enter through incredibly small gaps. Plus 2, despite the intensity of the current reporting, there are significant limits to what is known about the long-term trajectory of this surge. There is currently no widely available vaccine for hantavirus pulmonary syndrome, nor is there a specific antiviral treatment that has been proven universally effective once the disease reaches its later stages. Clinical management is largely supportive, involving intensive care and mechanical ventilation to manage respiratory distress. This lack of a silver bullet solution, its wire valence is so vital. Public health agencies are currently expanding their monitoring of rodent populations to predict future spikes and are working to improve the speed of diagnostic pipelines so that cases can be isolated earlier. The 2026 outbreak has highlighted the role of climate change in potentially shifting the habitats of reservoir species, driving them into new territories where human populations may not be as prepared. As the situation in Patagonia stabilizes and the passengers from the MV Hantavirus complete their quarantine periods, the focus will shift to a regional training workshop scheduled for June in Panama to refine international response protocols. For now, the message from the global health community is one of vigilant calm. While the Andes virus is a high-consequence pathogen with a devastating impact on those infected, its transmission remains limited by strict biological parameters. For more updates on this developing story and other global health reports, please consider subscribing to the channel. While the sensationalist framing of a forbidden zone has dominated social media headlines, official reports from the Southern Cone indicate a more nuanced but high-stakes public health operation. The core developments are currently centered on the coordination between the Argentine Ministry of Health and the Chilean Ministry of Health, supported by technical advisories from the Pan American Health Organization. These agencies are addressing the aggressive hantavirus surge through a dual-track strategy of clinical management and environmental containment. In the laboratory sector, diagnostic efforts are being spearheaded by the Malbrand Institute in Buenos Aires and similar reference facilities in Santiago. These labs are utilizing reverse transcription polymerase chain reaction, or RT-PCR, to detect viral RNA in patient samples. This molecular approach is vital because the initial presentation of hantavirus, fever, headache, and severe muscle aches, closely mirrors more common illnesses like influenza or dengue. By the time a patient presents with the hallmark fluid accumulation in the lungs, the window for early intervention has often closed. Consequently, health officials have prioritized the deployment of rapid diagnostic kits to rural clinics in the Patagonia region to ensure that potential cases are identified before they reach a critical state. The clinical aspect of this surge is particularly concerning due to the specific involvement of the Andes virus strain. Unlike other hantavirus variants found in North America or Europe, the Andes strain is the only one documented to have the potential for limited person-to-person transmission. This biological characteristic has forced hospitals in affected provinces like Chubut and Rio Negro to implement enhanced biocontainment protocols. Patients admitted with suspected hantavirus pulmonary syndrome, or HPS, are treated in isolation units where staff utilize high-level respiratory protection. The medical community describes the disease progression in two distinct phases: the prodromal phase, which lasts between 3 and 6 days, and the subsequent cardiopulmonary phase. It is during this second phase that the virus causes a rapid increase in vascular permeability, leading to a sudden drop in blood pressure and severe pulmonary edema. Because there is currently no approved antiviral medication or vaccine specifically for hantavirus, clinical management is strictly supportive. This includes the use of mechanical ventilation and, in tertiary care centers, extracorporeal membrane oxygenation, or ECMO, which provides life-sustaining oxygenation when the patient's lungs can no longer function, parallel to the medical response. Ecological surveillance teams are investigating the environmental drivers of the surge. The primary reservoir for the virus is the long-tailed pygmy rice rat, a species indigenous to the Andean Patagonian forests. Scientists are currently monitoring a biological phenomenon known as a ratada, or a massive rodent population explosion. This usually occurs following the synchronized flowering and seeding of specific bamboo species, such as the colehu bamboo, which provides an unnatural abundance of food for the rodents. As the rodent population increases, so does the prevalence of the virus within that population, a metric referred to by researchers as the seroprevalence rate. When these rodents eventually exhaust their food supply, they begin to migrate closer to human settlements, barns, and tourist cabins in search of sustenance, significantly increasing the risk of viral spillover into the human population. This ecological shift is what has led to the temporary closure of specific national park sectors and hiking trails, which the sensationalist reports have conflated with an entire region being declared unsafe for life on the international stage. The World Health Organization is monitoring travel and shipping logistics out of southern ports to ensure that the limited person-to-person transmission risk does not escalate. While there are currently no broad international trade restrictions, officials are advising increased vigilance for workers in the shipping and agricultural sectors who may come into contact with rodent-infested environments. The discrepancy between the verified information from health ministries and the viral claims of a forbidden zone highlights the difficulty of managing a high-consequence pathogen in the digital age. Officials emphasize that while the fatality rate of hantavirus pulmonary syndrome remains high, often exceeding 30%, the virus is not airborne in the traditional sense like a common cold. It requires specific conditions, usually the inhalation of aerosolized droppings in confined, dusty spaces or direct close contact with an infected individual's bodily fluids. The current focus remains on breaking the chain of transmission through localized containment and public education rather than regional abandonment. As the international community monitors the stabilization of the Patagonian hantavirus surge, the focus has shifted toward long-term surveillance and the implementation of rigorous prevention protocols. Public health officials emphasize that while the term forbidden zone is an exaggeration of the actual risk, the reality of living in or visiting an endemic region requires a fundamental shift in behavior. Prevention begins with understanding the mechanics of viral transmission. The Andes virus, like other hantaviruses, is primarily maintained in nature by specific rodent reservoirs, most notably the long-tailed pygmy rice rat. The virus is shed in the animal's urine, feces, and saliva. Humans are typically infected through the inhalation of aerosolized particles that are disturbed when dry nesting materials or droppings are moved. Therefore, the primary directive from the Pan American Health Organization is a strict prohibition against dry sweeping or vacuuming in areas where rodents may have been present. Instead, a process of wet decontamination is mandatory. This involves saturating suspected areas with a disinfectant solution, ideally a 1:10 ratio of bleach to water, for at least 30 minutes before any cleaning begins. This duration is critical to ensure the lipid envelope of the virus is fully degraded, rendering it non-infectious. For residents and workers in the southern provinces of Argentina and Chile, structural prevention is the second line of defense. Official guidance from the Argentine Ministry of Health stresses rodent proofing as a year-round necessity rather than a seasonal reaction. This involves sealing all holes and cracks in dwellings larger than 6 millimeters, the size of a pencil, using durable materials like steel wool or cement, which rodents cannot gnaw through. Furthermore, the management of the immediate environment is essential. Clearing brush, wood piles, and tall grass within 30 meters of a home reduces the likelihood of rodents nesting near human inhabitants. In the context of the 2026 surge, these measures are being paired with enhanced ecological surveillance. Biologists are currently conducting trapping and testing cycles to monitor the seroprevalence of the virus within the rodent population. By tracking these numbers alongside the seed cycles of the Colehu bamboo, health agencies can provide early warning alerts to specific departments before a human outbreak occurs. This proactive approach is intended to move the region away from reactive crisis management and toward a model of coexistence with an endemic pathogen. The limits of current medical knowledge, however, remain a sobering reality in the global health landscape. There is currently no commercially available vaccine for the Andes virus, nor is there a specific antiviral drug that has successfully passed the rigors of large-scale clinical trials for hantavirus pulmonary syndrome. While research into DNA vaccines and monoclonal antibodies continues at facilities like the United States Army Medical Research Institute of Infectious Diseases, the current standard of care remains high-intensity supportive therapy. This underscores the ethical responsibility of public health reporting. It is vital to balance the need for caution with the prevention of unnecessary panic. The forbidden zone rhetoric, while capturing attention, risks stigmatizing local communities and damaging the economic stability of regions that rely on seasonal labor and tourism. Officials argue that the goal is not to abandon these territories, but to navigate them with a clear-headed understanding of the risks. Ultimately, the 2026 hantavirus surge serves as a case study in the intersection of ecology, travel, and public health. It highlights the necessity of international cooperation in tracking pathogens that do not respect national borders, particularly those with the potential for person-to-person transmission. The global health community remains vigilant, recognizing that as human activity continues to encroach upon wilderness areas, the frequency of zoonotic spillovers is likely to increase. The honest limit of our knowledge is that we cannot predict exactly when the next ratada or population explosion will occur, but we can refine the speed of our laboratory response and the clarity of our public communication. For those living in or traveling to the southern cone, the message is one of informed precautions. Stay on marked trails, store food in airtight containers, and never enter a closed-up building without proper ventilation